How much trouble are we actually in? I'm scared people aren't taking this seriously enough. Think about the incubation period of the virus being 27 days. Panic buying. I think people are just really afraid of or continue with life. Vacation in a week. Don't want to miss it. The outbreak will become more significant in Europe because people don't wear masks. The virus is overrated or underrated. You hear meowing? That is Boots. Yeah, all right, Boots. The most popular question I've been asked by far, forever. How is my friend in Wuhan? She is good. I don't think she even knows I have a YouTube channel. She's not a big fan. So she probably won't see this. But she's good. China itself is getting much better. I think there were only 14 new confirmed cases today, which is less than Italy. And obviously China's a bit bigger than Italy. China is the size of Europe. So China's definitely doing better. I assume I'll probably be going back in about a month. That's what we thought at the time anyway. 3 months, around 3 months, get it under control. I can't say that's the case for Europe or America. I can't say that this will all be grand in 3 months. I did say that about China when I first left, because China have dealt with this before, and China is a different animal to the rest of the world. They locked down a city of 11 million people and just locked it down. And it was quite an amazing feat. I don't think any other country could do such a thing. Not in the same way, not as effectively. So that's what we said about China. I said about 3 months, and coming into April, I'll be probably going back. She is good physically. She's physically very well. She's not got the virus. She's still there. Her cats are well. Her cats are keeping her sane. But just think about how you would be if you were locked in your apartment for the best part, for more than 50 days. How would you feel if you were locked away from the world, away from human contact for 50 days? So she's as good as can be. She's alive and healthy, physically. She's grand. And I'll be seeing her next month, probably, more than likely. So that was definitely by far the most requested question. Someone somewhere asked me to talk about the racism that's going on behind this. People are racist. There's a lot of racist people in the world. People are just using this as another excuse to be racist. People have actually died because they are Asian and wearing a mask, and they've been killed. So that's horrible. There are a lot of horrible people in the world. But there's not much I can say about that. It's horrific. People are atrocious sometimes, and horrible people are finding an excuse to be horrible. In this case, horrible people are finding an excuse to be horrible to Asian people. And I'm not even saying Chinese, I'm saying all of Asian people, because these racist people don't discriminate. They don't distinguish between someone who's Japanese and someone who's Chinese. They're just racist, and they're awful. It's terrible what's happened, but racist people are awful. So they do awful things. I don't mean to kind of brush over that really quickly. I don't mean to kind of just brush off all the horrible racism that's been happening. But it's terrible. It's absolutely awful. And there's nothing, what can be done about racist, ignorant people? They just find another excuse. And unfortunately they have a coronavirus excuse. It's never an excuse, but people will always justify their horrible actions some way. Here is a couple myths busted. Because this is a very depressing video, isn't it? We'll try and sprinkle some humor into this, because this is just awful. Can it affect your hearing was the question. I mean, in the same way a cold can affect your hearing. You know, it's not going to leave you permanently deaf. But, you know, when you get a cold, you blow your nose and your ear pops kind of thing, and you can't hear very well out of an ear for a few days. Obviously get it checked for an ear infection, but it's not a symptom. And it's not something that will be caused by the COVID-19. Another myth, does COVID-19 cause infertility? No, it does not. Thank you for cheering up this video, Boots. Where are you? Meow. One question there, are you worried about it spreading in the UK? I'll refer to that as Europe. Are you worried about it spreading throughout Europe? I'm not worried. I know it will spread throughout Europe. It's already spread rapidly in Italy. And it will do that in every other country it gets to because it's so contagious. It will spread, things will shut down. To answer other questions, schools will close very soon. And I assume online classes will start the way they have for me in China. I'm teaching still online. All of these things are coming to Europe and they will be coming soon. If they don't, then that's insane. I'm not sure about the public transport shutting down because what happened in Wuhan can't really happen here. People would be rioting if their city was locked down the way Wuhan was, which is why I said a few times Wuhan was a great place for it to happen so that it could just be shut off. But even then, this virus is so contagious that it got out. Will the virus stop spreading after the summer? The summer will help. The summer will help because the virus was, originated during winter, and most viruses, go away. You don't really get a cold in the summer. Coronavirus, you don't get a coronavirus in the summer. Often, it will help, but experts, not myself, are saying that it probably won't destroy the virus. The virus will still probably be kicking around after summer. So the summer will definitely help, but the summer won't kill it completely. People with asthma, should you be more worried? Excuse me. People with asthma, should you be more worried? Everyone should be equally as worried without panicking. Here's a very good answer for you. But if you have any underlying condition, not just asthma, if you've had cancer, if you have HIV, things that weaken your immune system, then this virus will take hold and you could be part of the 2 to 3%. Or you could be part of the 10% that have health conditions for the rest of your life because of this, like lung scarring. I'm just using that as the example I go to every time. With asthma, you just need to be more cautious than the average person. The average person will probably recover and be okay. But with asthma and any underlying health condition, definitely need to be more cautious. But everyone needs to take the precautions. In the 40 minutes I've been making this video, I already know a lot is going to change. Schools will be closed soon across Europe and America, the way that China has. The thing that's annoyed me the most is that no one has looked at what China did wrong in the first few days. China has recovered very well by locking down a city of 11 million people, but Europe and America won't be doing that as easily. People will riot if that happens to them. People will then properly freak out. So that won't happen. Boots, settle down. His heartbeat is pumping. Settle down, boy. I'm gonna put you right there. Can you just sit on my lap? Okay, I'm gonna do the rest of the video with Boots now. By the time this video goes on YouTube, I think a lot will have already changed and precautions will be taken. Public transport will be different. I'll lower the camera so you can see him. That's perfect. I think public transport and schools will definitely close very soon, just because they really need to. Europe didn't look at what China did wrong and think, okay, we won't do this. No, Europe has almost identically copied exactly what China did wrong, and thus it's everywhere. So that was very annoying to just watch twice in China and then Europe. China have handled it much better since then. That's why China is now probably one of the safer places to be, whereas Europe is on the down. And it's literally only beginning. It's gonna get so much worse. Again, this isn't to scare you. If you take your precautions, there's nothing else you can do. Wash your hands, don't touch your face, wash your phone, stop using cash. Those are the 4 big ones. Wash your hands, don't touch your face, wash your phone. This is my Chinese phone. There you go, there it is again, obviously it's woman. Woman. Food. Wash your phone and stop using cash. Those are the 4 big ones. Other than that, what more can you really do without overthinking it? Just try and stay healthy. Okay, I think this will be the last question because this has been a seriously long video. Do I know anyone directly affected? I do not know anyone directly affected by this virus. I do not know anyone that has been infected by COVID-19, but people can recover and you just have to hope that you can. That was another question. Some of these questions I won't be able to find, but I did read them. How long does it last? Depends on you as a person. Depends how healthy you are, how healthy your system is, how well you fight viruses anyway. So if you get a cold and you struggle with a cold, then you'll struggle with COVID-19. Some people can have had it. Some people can have had it. Some people can have had it and not known they had it and recovered. That is what's the dangerous thing. That's why it spreads, because people have it and they don't realize they have it. Give it to other people who suffer more, and then that first person already recovers without ever really knowing. Sore throat isn't a symptom. They got rid of that fairly early on. Another question, can you tell the difference between a common cold and the COVID-19? Because they are both coronaviruses. A fever is the big symptom to look for. If you're snotty and you're sneezing everywhere and you're coughing, that's probably not COVID-19. Fever is the big symptom to look for. Sorry, I don't know if you can see this. He's very comfy. Aren't you? Look at you. Bringing a bit of joy to the video. Good lad, Boots. Can you hear the purring? Yeah, I think I'll leave that video here. It's probably quite a long video already. If there are any other really pertinent questions that I didn't get to, I'll probably answer them in the description. So have a look there, and we'll probably timestamp each question so you don't have to sit through the whole video. You can just look through the description and see if I answer your question there. Okay, thanks for watching.